Diabetes is serious.
My blood sugar was fluctuating back and forth, up and down,
And it's really important to have people prevent this chronic disease.
According to CDC, the Center for Disease Control and Prevention, diabetes is a chronic health condition that you pretty much have to live with. But what if it was not the case? In the recent year, we've understood better how this condition is created and way to reverse it. Many diabetes patients have been able to achieve complete remission to a point where they completely stop taking medication, including some who had dealt with diabetes for more than 15 years. Let's start by having a look at how this condition is created. When you eat carbohydrate, especially low-fiber carbs like white bread and rice, your blood sugar or blood glucose goes up. And your pancreas releases insulin because the job of the insulin is to get the glucose into the cell so it can be used for energy. Insulin is a hormone and it pretty much acts like a key that will open the door of the cell for the glucose to enter. It basically binds with the target cell receptor like a key fitting into a lock. Once the insulin is in place on the cell, the door is now open for the glucose to get into the cell and be turned into energy. And of course, we get the maximum amount of insulin released from the pancreas when we eat carbs. Way less when we eat protein and a negligible amount when we eat fat. Now, for someone with type 2 diabetes, the cells have become insulin resistant. It basically means they have become resistant to the action of insulin and need a bigger dose to get the same job done. And how do you usually become resistant to something? By getting too much of it. The human body is amazing at adapting. That's how we survive throughout centuries. So when the body is getting a constant dose of something, it adapts its response and becomes less sensitive to it. Like with alcohol, for example. If you compare someone who just tried his or her first sip of alcohol for the first time with someone who drinks every day, you can tell they won't react the same way. The shot of tequila will have little to no effect on the regular drinker, while it may be enough to make the other guy dance on the table that night. Now, somewhat the same concept is happening with insulin. If you eat a lot of heavy carbs every day, your cells are frequently getting a high dose of insulin so that all the glucose can be cleared up. And your cells eventually get used to this frequent supply of insulin and they react less and less to it over time. So with time, in order to process the exact same amount of carbs than before, you need more insulin. A bit like an addict who constantly needs a higher dose than the previous one to get the same buzz. You kind of got your cell addicted to insulin. Thing is, your pancreas doesn't have unlimited production capacity. So eventually you reach a point where you're not releasing enough insulin to clear up all the glucose that is building up in your bloodstream. And that's when your doctor prescribes you insulin injection. But guess what? You're now making your cell dependent on an even higher dose of insulin. But given the constant supply of carbs, you have no choice because you need to clear up that glucose. And as you keep getting a lot of insulin in the bloodstream, your cell keep getting more and more resistant. It doesn't really matter that your blood glucose level are getting better. The diabetes is actually getting worse. Simply put, insulin causes insulin resistance. And if that wasn't enough, when you're eating high carbs without sufficient fiber, the insulin also signals your body to store additional fat from the dietary fat you're eating. More specifically, it creates intramucosal lipid, which is fat inside your muscle cell that also interfere with the ability of insulin to clear up the glucose properly. This process is called reesterification. So basically, when insulin is around, the fat you eat is more likely to be stored as body fat, and some of it will end up in the muscle. If you've been following till now, chances are you understood that a vicious cycle is created when you eat a high-carb diet without sufficient fiber. When you eat a lot of carbs, it raises insulin, and insulin will create insulin resistance and make you store more fat. It means you'll need more insulin the next time you eat the exact same amount of carb, and this whole cycle will keep speeding up. And once you get to a point where you need to inject insulin, then you are really speeding up the cycle. So how can you break this cycle? Well, somewhat of the same way that you would do for any addiction. You need to remove the source of addiction. And in this case, it's the insulin, which comes mostly from the carbs. But if you do that, you need to give your body an alternate source of energy. And we know that historically, the human body has worked well on ketone, which is what the body produces as source of energy on high-fat diet. So instead of getting its main source of energy from the glucose it extracts from carbs, it gets its energy from the ketone generated from the dietary fat, which does not lead to insulin release. So you'd want to have the people doing a diet that is high fat but very low carb and therefore very low in insulin. And this would be like the ketogenic diet. The ketogenic diet, unlike all other diets, leads to a change in the body's preference for its main source of energy. While in most other diets, the main source of energy is glucose, ketone become the key source of energy here. In the recent years, more and more studies have been conducted on low-carb diet or keto diet as a way to reverse diabetes, and it's been probably the most promising avenue so far. Some patients have had amazing results. Dr. David Unwin from UK has been one of the leading figures in the low-carbs approach over the last decade. He has helped many of his patients with type 2 diabetes achieve remission, even two patients who had dealt with diabetes for more than 15 years. In a recent study published in BMG Nutrition, Prevention and Health in January 2023, he showed that about 97% of type 2 diabetes patients who adopted a low-carb diet experienced improvement in blood glycemic control, and 51% achieved remission, which means they were able to eventually stop taking medication. Overall, he estimates the chance of full remission at 77% within a year of diagnosis, 50% if diagnosed in the past 3 years, and 20% for those who have been dealing with type 2 diabetes for more than 15 years. Bottom line is, the chance of remission are obviously higher for recent diagnosis, although it's not impossible for those who've been living with the condition longer. It may just take a bit more time for your cell to be reconditioned to a healthy dose of insulin.